Hello mamas, welcome to Talk with Dr. Chinny. By the end of this video, you should have understood the different kinds of nappy rash. You should have understood what to manage all the different aspects of it and how to prevent it from reoccurring. Why is this important? About 25% of babies wearing nappies at any given point of time ends up having nappy rash. So whether you like it or not, you somehow come across this as a pregnant mom waiting to have her first baby or an experienced mom have already had her baby. So nappy rash is something we can't really run away from. It's best to understand it and then know how to manage it and prevent it from reoccurring. So first thing, when a baby has a nappy rash, you can see the baby is agitated, the baby can be feeling itchy, but they can't express themselves to you. The baby can be in pain, the baby will just be in distress and uncomfortable. So there are 4 different causes of nappy rash. The first one is friction nappy rash. The second one is allergic nappy rash. The third one is bacterial nappy rash. And the fourth one is fungal nappy rash. So the first one, friction. Friction is basically when something is rubbing aggressively or strongly on an area. So when your baby's nappy is tightly fitted, so let's say a baby that should be wearing a size 1 is wearing a size 0, that will be very tight on your baby and it will literally be rubbing harshly against the skin. So when this kind of friction happens, you will notice some bumps, some swollen and inflamed areas, and your baby will be in pain. So what do you do in that kind of scenario? Once you identify, because when your baby is wearing a diaper, it should be comfortable. You should be able to insert a finger or 2 in between. And what happens with this is that your baby will be comfortable when they sit down, or when you prop them up in a seated position, they wouldn't feel that this is very tight on their skin. So once you identify that friction is the reason for this bump and discomfort baby is having, you just need to go up a size, and then in your next diaper change, you apply a barrier cream to help soothe the bump, the pain, and then wear a good fitted diaper. And if for some reason your baby is wearing the exact size they're meant to be wearing, so just don't make it extremely tight. Just allow it to be comfortable for your baby. The second one we're going to discuss is an allergic nappy rash. Allergic nappy rash happens when a baby is reacting to a product or something. So babies have very sensitive skin, and because they have very sensitive skin, they can react to anything. And this is why we always advise not to expose your baby's skin to harsh chemical products like the baby washes, the baby creams. Your baby's skin does not really need that, even for the first 6 weeks of life. So what you need to do when you're suspecting an allergic nappy rash is to see what it looks like. So when there is an allergic nappy rash, what you identify first is that the whole rash is going to be like a very rough kind of rash, and it's all going to be present along the area where that product is coming in contact with your baby's skin. So different kinds of products that are used in the nappy area are your baby's diaper. If it's a fragrance nappy diaper, it can show that anywhere this nappy is touching your baby's skin, there is a widespread rash going on there. The other thing that you can identify is maybe your baby's wipe. If your baby's wipe is also a fragrance-based wipe that has some alcohol in it and your baby is maybe sensitive to it, you will find that the areas that you use that wipe, the places that you're wiping your baby, you would notice that the rash will just be focused widespread in that said area. If for some reason you're using lotions, you will find that this rash is not just only on the nappy area but also in other parts of your baby's skin. The same thing if you're using soaps that your baby's skin is is reacting to, or if you're putting up a bubble bath, all those things have like some chemicals in them that can be harsh on your baby's skin. So you really do not want to expose your baby's sensitive skin to these sort of things. What do you do with an allergic nappy rash? You identify the real product that is causing the reaction, you separate it and stop using it. And what you will find is when you stop using it, that rash would improve and then new ones wouldn't develop. So but with the main time while your baby's skin is that rough, it's going to be uncomfortable, so you can still use the barrier creams whenever you're changing the diaper, so that it can help your baby's, it can suit the skin and help your baby feel a little bit more comfortable. Okay, so the next nappy rash we're going to discuss is the fungal nappy rash. The fungal nappy rash is commonly seen when the baby has like thrush. So thrush is when there is like, it's a fungal infection by candida, and you will see some white plaques on the mouth or on the mother's nipple or on the baby's nappy area. So when there is thrush that is ongoing in the baby's mouth or from the mom's nipple, definitely you can be sure that the rash your baby is having is fungal related, and an antifungal would help it. But if your baby is not having any of this and you can identify that this is not other classes of nappy rash, you need to take your baby to the doctor so that your doctor can be able to understand better if this is a fungal rash or not. And if it is, your doctor will prescribe an antifungal for your baby to use, because that will be the best thing that will stop it. And if it's a mom that has a thrush, it will require both mom and baby are giving a complete treatment for that, an antifungal complete treatment to get rid of the candida that would be spreading the thrush and the rash. The last one we're going to discuss is the bacteria nappy rash, which is the most common. So I left the juicy one for the last. So it's the most common nappy rash that you can find, and this is really when a mom leaves the nappy for a prolonged period of time. So when your baby is wearing their nappy, they pee in it and they poo in it. So you have wet and soiled nappy. This wet and soiled atmosphere in the nappy, in a closed environment, in contact with the skin of your baby, is a perfect breeding ground for bacteria. Like, they're just going to go on multiplication over and over again. So you do not want that, because once your baby is sitting in that pool of bacteria home, you know, is going to lead to breakdown of your baby's skin, is going to lead to this rash that will have some pus in it. Is not a very convenient thing. How do you know this is what is causing it? You notice that every time your baby has nappy on for a long period of time and you take it off, you would see maybe this red area, or you would notice that the skin is looking a bit soft and broken on one side, or you would see some rashes that have pulses in them. These are just sort of the things that you can notice that will help you understand that this diaper has stayed for a prolonged period of time. Ideally, you shouldn't really keep your baby's diaper on for more than 4 hours. And at any given point in time, when you found out that your baby has soiled their nappy, it's important to take it off, because you don't want to give room for bacteria to grow, and then in their growth they affect your baby's skin. So what do you do in this kind of scenario? Like I said, monitor the timing of the diaper. Some diapers have a colored code to help you understand when it's filled up enough to change. You know, I don't allow 4 hours or more to go by, especially for newborn babies. And then when you start changing frequently, also allow some air to get on that nappy area. So give some nappy free breaks, you know, or maybe spend a little bit of time during the nappy change time to give room. So to manage this, you need like an antiseptic, and also like because it's irritating, you also need like a barrier cream to prevent that skin from rubbing on the diaper and giving some pain and discomfort for your baby. You need to go to your doctor for bacterial nappy rash so that your doctor can prescribe an antiseptic for you and also keep an eye on it. Most of these nappy rashes would resolve at home just with this little management. In some severe cases, when I talk about severe cases, I mean like you've applied the barrier cream the first day, the second day is not improving, rather you're seeing more widespread of the rash, more of it is coming out. So in that kind of scenario, you just need to go back to your doctor, because you may have figured that you're managing a bacterial rash. You're managing a bacterial rash, but instead your baby actually has an allergic rash. So in that scenario, your doctor will be the best to identify what is the real cause of this nappy rash. And in some cases, your baby might need some extra antifungal treatment, some topical